Hi, I'm Dr. Amy Shriver with Blank Children's Hospital. All caregivers worry when their child gets sick. This can cause a lot of stress, missed work, missed school, and expense. In this video, I'm going to talk to you about infections in infants and young children and what you can do to support them and help them feel better. What kinds of infections are there? There are many different types of infections in infants and young children. By far, the most common type are viruses. However, infants and young children are susceptible to other types of infections, such as bacteria, fungi, and parasites. Your pediatrician is trained to help you diagnose and treat these issues. Why do infants and young children get sick so often? Infants get sick often because their immune systems are not fully developed to protect them. Also, between ages 3 and 4 months, children start putting a lot of different things in their mouths, which can lead to increased infections. Some other factors that can influence whether a child gets sick can be the age of the child, their genetics, their exposures, and their underlying medical conditions. Children who attend daycare may be more likely to experience exposure to infections. Other children who experience home stress, trauma, or violence may be more prone to infections. And children with chronic medical diseases or conditions such as asthma, diabetes, or eczema may also be more prone to infections. Most children will experience 6 to 8 infections every year. These infections can include colds, ear infections, sinusitis, pneumonia, and vomiting and diarrhea. How do you know when your child needs a doctor? Whether or not a child needs medical care depends on many factors. A very important factor is your child's age. If your child is less than 1 month old and you're worried that they may have an infection, you should call right away or seek medical care. If your child at that age has a fever of 100.4 or greater, they do need to see a doctor. In children ages 1 through 3 months, they are still very prone to infections and are very vulnerable. So if you have concerns between 1 and 3 months of age, you should call your doctor. In children older than age 3 months, you may start to notice other signs of infection or illness. Such signs can include fussiness, poor eating, poor sleeping, or changes in their urine or stooling habits. If you notice any of these things or see your child with an increased cough or fever, you can call your doctor for further medical advice. What can you do at home to help your child with an infection? There are many things you can do to support your child at home. Make sure your child is drinking plenty of fluids and getting plenty of rest. But beware of many over-the-counter medications. In children under age 4, many of these medications are not recommended and not effective. Some of them will have serious side effects for children. Always contact your doctor if you are interested in trying a medication for your child's illness. How can we prevent our child from getting frequent infections? Okay, so we can't prevent our child from every single infection, but there are some things that we can do to help our children stay healthy. First, good nutrition and regular checkups with your doctor and dentist can help your child maintain good health. Second, good hand washing at home for you and your children will help them stay healthy. Also, making sure that you manage your child's chronic illnesses if they have any, like diabetes, asthma, or eczema, will help your child stay healthier. You should also try to limit your child's exposure to other people who may be sick. For example, try not to bring your very young infant into large crowds. Vaccinations are one way we can help keep children and adults safe. Make sure that you as an adult get your flu shot every year and have had your pertussis or whooping cough shot as well. And make sure that you're following your pediatrician's recommended vaccine schedule for your children to keep them safe. Frequent infections, including fevers, are very common in young children. However, if you're worried that your child has had more than you're comfortable with, please contact your doctor and make an appointment to have them seen.